I would like to highlight few of the facets of World Bank's engagement in health sector in India, particularly in the context of current COVID crisis. We may know that the bank has offered a $1 billion loan to government of India for emergency COVID response. Though it might look like a novel idea apparently, but if you look at the conditionalities of the loan, you'll realize that the government has to actually actively engage private sector laboratories and diagnostic facilities in COVID response. It also mandates that the Indian Council of Medical Research has to make use of private sector research institutions along with public bodies in COVID-related research. Now, World Bank, it is quite expected, would propose such attempts or take up such attempts to privatize healthcare services, because the kind of weak public system we see here in India today, and the failure of the public system in dealing with COVID somehow is linked to some of the aggressive health sector reforms that the World Bank pushed in India in late 1980s and early 90s. We know that in that period, public budgets on healthcare had been cut continuously to historic low. We also know that recruitments in health sector were frozen, new facilities were not built, and as a result, the quality of public care suffered immensely, and people eventually went to private sector for delivery of healthcare. We also saw World Bank's attempt to privatize healthcare, bring in public-private partnerships in management of public facilities or in ancillary service. And as a result, what we see today is use of private sector for healthcare. And we also know the disastrous consequence. We know that around 50.5 million people get impoverished in India because we are not able to provide financial protection. And in the time of COVID, we have seen that the way private sector has completely failed in providing any relief to the health sector, the health of the people. Now, there was also, I want to emphasize that in the name of universal health coverage, World Bank have been aggressively pushing for tax-funded health insurance programs like we have in the form of Prime Minister's Jan Arogya Yojana or its earlier avatar like Rashtriya Swasthya Bima Yojana. And these are essentially attempts to use public money to push private profit. And we have seen in this time of crisis that all of these schemes have failed miserably to provide any relief to people. Now, this is an extraordinary time, and we see that whatever little service has been provided is through public system. The fault lines of public system has been exposed, but at this point, there is no other option for us to strengthen, invest on the public system and build a resilient, strong healthcare system in the country so that people's miseries can be taken care of and we can avoid such human calamities like we have seen in the time of COVID. Thank you.